Good morning. I'm here with Deb Gulbrandson, and she is one of the co-instructors of the Osteoporosis course. And Deb, can you tell us a little bit about yourself, your background?
I've been a physical therapist for 46 years. I'm also a Pilates instructor. And so a lot of my Pilates training in terms of things like visual imagery and cueing patients to get the right movement technique into their bodies has really helped me as a physical therapist. I had a private practice for 30 years in the Chicago area. And about 3 years ago, my husband and I semi retired to Colorado. I now have a small cash based physical therapy and Pilates practice. And I also work part time for a home care and hospice agency. I've considered myself mostly a generalist PT, done a little bit of everything. But as I've gotten older and become more aware of the challenges of the aging body, osteoporosis has taken on more of my focus. And that's what led me to become an instructor.
And what originally brought you to this work then? Because you have been working with this particular topic for a long time.
Well, I took Sarah Meek's course almost 20 years ago. And honestly, I took it because it was local and it was something I didn't know much about. And so I thought I would just kind of add that to the many tools in my toolkit as a therapist. But I was really intrigued with the specificity of the Meek's method, the way we target certain areas, certain muscles to strengthen the body, and found that it was good not only for people with osteoporosis, but also people with back pain. I mean, all you have to do is go to the grocery store or the airport and just watch people, which as therapists we do. Everybody, almost without exception, as they get older, start to become more forward slouched. And and one of the things that Sarah said that really resonated with me is as we see people bent over, it's not necessarily because they age, it's what happens to them in life as they age, and whether they do or they don't do certain things to counteract that. And the fact that, there is something you can do about osteoporosis beyond just taking medication was really hopeful. And as I started working with patients, that was one of the big things they were wanting to know: what can I do? We certainly don't get into discussions about medications other than to say you need to be informed. And in our course, we created a medication cheat sheet, basically, so that we were familiar and our participants can be familiar with the different kinds of medications that doctors may suggest. And we say, have an honest conversation with your physician about the medications, and you ultimately make the decision. But the nice thing is, as therapists, we have such an arsenal of non-medication options in terms of exercise, in terms of posture, in terms of balance, in terms of even we've added some basic nutrition to our course, so that we really want people to feel like they do have options, and that they are informed.
Wonderful. Well, you've touched on some of the different categories that you're covering in the course. What do you think is one really interesting and perhaps unique aspect of what you teach to participants that opens their eyes a bit about how this really is that specificity is so important? In other words, someone might say, oh sure, I get folks walking, doing weight bearing, we know all that stuff. What's one piece of information that participants tend to come to you afterwards and say, wow, that seems so perhaps even simple but really profound?
Right. And you're exactly right. The simplicity is the beauty of it. It is not difficult when it's done correctly. Frank, my partner, my business partner, and I really latch on to the proper technique. We want therapists to be able to feel it in their body and make sure that their patients are doing it correctly. It's just kind of a thing of mine that I see people, elevating their shoulders when they're doing shoulder flexion or abduction, and it's so important for the education piece, I guess, with our patients, that they understand the mechanics of what's going on, and so that they can learn to do it correctly. And it isn't about just, pumping a bunch of iron. It's being very specific with their core control, with their ability to relax muscles that don't need to be working. I mean, we find, all of us are in the seated position more so than ever, working on computers and driving and typing and on and on. And that just pulls us forward. And so training people in little tips that they can do throughout their day in terms of just sitting. And again, as therapists, we know about sitting posture, but we tweak it. We give them things like foot support, that sitting in a chair, just like building a house, if you don't have a firm foundation, the walls are going to collapse. And that's what we see with a lot of our patients. And so teaching and training them where they need to focus, and when they are overcompensating, when they're tensing their neck and their shoulders because they don't have the stability. It's as important to train out muscles as it is to train in muscles.
Hmm. And one of the aspects of clinical care that I've noticed over the years is that when patients are first diagnosed with osteopenia, for example, it's very scary. And even folks who have osteoporosis tend to have this attitude of, well, I have this condition, therefore I cannot. And so, can you speak a little bit to how this course really helps not only alleviate that fear, but empower patients as to what they can do?
Sure. I think one of the things that I love about working with osteoporosis and or osteopenia patients is that they are so motivated, that, we always are challenged with those non-compliant patients with their home exercise program. These patients want to know, what can I do? And how can I, first of all, they don't even realize that they can have an effect on it. And then when they do find out that they can, they're just, give me more, give me more. And the nice thing is, it's basically a home exercise program. And so teaching them that this is going to be for the rest of your life. These exercises are simple once you get them down, but you will continue those throughout your life. And in a way, if you now know that you have osteoporosis or osteopenia, you can be smarter about the way you move, getting dishes out of the dishwasher, doing laundry, making a bed. We teach them the hip hinge. We use a dowel rod so that they get that feedback when they're actually starting to bend their back. We measure their height when they start. And because they're what we call hyperkyphotic, the thoracic spine, a lot of times you'll read, patients have a kyphosis, and yeah, we're all supposed to have a thoracic kyphosis, just not the hyperkyphosis. We measure them when they start, and a month later, we remeasure them. A lot of them have gained height because they have actually flattened the curve, to use current jargon with COVID. We're trying to help reduce that hyperkyphosis, and that helps bring back their length and their height, which further motivates them and gives them that feeling and that empowerment that I can do something.
And that they can have that immediate effect.
Exactly, exactly. And so some of the tests that we teach, the evaluation, are a little different than the typical orthopedic PT patients. We measure, it's called a wall to occiput, or tragus. Tragus is that little thing in your ear, the distance from the back of the wall to either the back of their head or the tragus. Frank uses the tragus more. I use the occiput. It both give you an indication of how far forward a person is, and then again, 4 weeks later, measure them again, and they can see that improvement. And the idea is, we want alignment. We know that weight bearing forces through the body increase bone density, but if we're out here and the forces are coming down through the front of the body, that's not good. And so the more we can get them into alignment, then the weight bearing activities, the walking, the weight training, has even more effect in a positive way.
Wonderful. Well, Deb, we're so happy that you've partnered with the Institute to offer this course. It's just such useful information for so many people.
Thank you. Yeah, I think that because osteoporosis is a silent disease, a lot of therapists are working with patients who have osteoporosis or osteopenia and may not know it. The patients themselves may not know it if they haven't been tested. And unfortunately, sometimes people don't find out until they actually have a fracture. So for those generalist therapists to be aware of there could be fragile bones involved, even though they're seeing them for a different diagnosis. And here are some tips. Here are some ways to screen people for that. I think can really bring a lot to the table for the betterment of our patients.
Excellent advice, and for us and for our loved ones as well, right?
Exactly.
Thanks again for sharing some information about your course this morning, and we look forward to having folks get to meet you and learn more about it in person.
You're welcome, Holly. Thank you.